There's obviously different types of behavior management techniques that we use in pediatric dentistry. Some of them are pharmacologic, some of them are not. Usually we kind of start with something that's very simple, like distraction, tell, show, do, see if we can kind of guide them into being confident about getting through the procedure. But a lot of times, kids grow at their own pace and they're at different point of their growth and development. Sometimes the mental maturity is just not quite there to comprehend the type of strength that they need to get through the procedure. So we do have some tools that we do use, nitrous oxide being the pretty popular one that's also known as a laughing gas. So a lot of times, nitrous oxide doesn't necessarily cause anesthesia in any way. It's very minimal, if any. It's mostly kind of decreasing your level of anxiety. So when kids are really anxious and nervous about a procedure, nitrous oxide can be a really good tool to kind of bring down their level of anxiousness and kind of make them feel calm and be able to listen to the guidance that we're trying to guide them through the procedure. But like every other medicine or technique we use, it works great on some kiddos and doesn't work great on some kiddos, but we won't really know until we try. So we usually kind of start with the very basic, non-invasive techniques and we kind of work our way up, and nitrous kind of being in the middle. And if nitrous oxide also isn't working out well and we're still very anxious and unable to get through the appointment, and obviously our goal is to create a non-traumatic experience for kids as possible. So if we're kind of leaning towards this is going to be a traumatic experience for the kiddo to undergo this procedure, then we usually call it and say we might need a little bit more advanced technique to kind of manage behavior. And a lot of times that kind of turns into sedation, such as like oral conscious sedation, general anesthesia, especially if a kid has a lot of teeth that we have to work on, let's say 7 or 8, meaning we might need multiple appointments, and if we had a really rough time the first appointment, then it might be best to protect themselves to kind of get all the work accomplished all at once while they take a nap. Sometimes that is the only way to kind of protect their psyche. So we kind of gauge how much they can do and how much they can handle and kind of go from there.